Radiology is one of the majors I'm looking at going into as a profession now that it has come to my last year of high school. I have yet to decide where I will be attending college, but it is a good start to know what I'm planning on studying. I'm so excited to show you what I know about this topic in my speech today. With so many questions from my listeners and questions that I had some good research has taught me a lot. What is radiology is one of the major questions that I'm going to go into detail on today and try my best to give you the definition of the job. Radiology is a specialty of medicine and a study of imaging technology to diagnose and treat disease. The following imaging models are used in the field of radiology. Plain radiology was the only imaging modality in the first 50 years of radiology. It is still the first study ordered for lungs, heart, and skeleton because of the speed and low cost. Fluoroscopy is where the fluorescent screen and image intensifier tube is connected to the TV system. CT scanning uses X-rays also, just in a different form. CT scanning can detect more subtle variations. It is also exposes patients more ionizing radiation than radiograph. CT scanning can put fine details into 3D images with the help of administration of IV contrast during the scan, which is very helpful when dealing with tendons, muscles, and organs. Faster scanning time and better resolution has increased. Ultrasound is used to explore soft tissue structures in the body. The quality of images is dependent on the skill of the person performing the exam. Ultrasound can't be seen through bone or lungs or bowel loops. The first ultrasound was two-dimensional, but now in modern time it has become 3D and effectively becoming 4D. MRI uses strong magnetic fields to align protons with the body tissues. A large disadvantage is that the patient has to hold still for a long period of time in the noisy, cramped area while the image is performing. Nuclear medicine imaging consists of substances and body tissues being labeled with radioactive tracer to stand out in the results. The heart, lungs, and liver and gallbladder are commonly evaluated with these techniques. Radiologists' duties may vary depending on where they are employed because of different specialties and departments at each facility. Radiology technicians adjust and maintain imaging equipment. They follow the physician's orders on what areas of the body to image. Patients need to be prepared for a procedure by asking questions and taking medical history and positioning. Shielding exposed areas that do not need to be imaged is also an important duty of radiologists to avoid exposure. Positioning the patient and equipment in the correct area is vital to be sure the image is captured correctly for X-rays for surgical procedures that need guidance. Radiologists must know how to operate the computer to take the images and determine whether other pictures need to take. Like all medical departments, keeping detailed records of the patient is also required. Using many types of equipment, radiologic technicians may specialize in X-ray, computed tomography, or also MRI equipment. They may also specialize in mammography to produce images of the breasts. Radiology technicians held about 219,000 jobs in 2010. Technologists are often on their feet for long periods of time and may need to lift or turn patients. They may also be exposed to infectious diseases. Although radiation hazard exists in this job, they are minimized by the use of protective lead aprons, gloves, and other shielding devices. Technologists wear badges that measure the radiation level and keep records. Most technologists work full-time because imaging is needed in emergency situations. Some may work evenings, weekends, or on call. To become a radiology technician, an associate's degree is the most common educational path. You must be licensed or certified in most states. There are formal training programs that lead you to an associate's degree or bachelor's degree. Because the associate's degree is most common, certificate programs typically last to 6 to 12 months. Both programs include both classroom training and clinical training. Classroom work includes anatomy, pathology, patient care, radiation physics, and protection and image evaluation. Suggested classes for high school students should focus on science and math, such as anatomy, biology, chemistry, mathematics, and physics. Radiology technicians must be licensed or certified in the state they practice in, must have graduated from an accredited program and passed a certification exam from the state. Some of the skills would be interpersonal skills, science and mathematical skills, and stamina, and technical skills. Employment of radiology technicians is expected to grow by 28% between now and 2020, faster than average for all occupations. The field is expected to grow because of the shift toward outpatient care when possible. When having multiple certifications, you'll have a better job prospect. The median annual wage for a radiology technician is $54,000 in May 2012. The lowest 10% earn less than $36,000, and the highest 10% earn more than $76,000. And an average median salary for a radiology technician in Minnesota would be $46,000. To increase your salary, you can specialize in more radiology programs such as CT Tech, mammography, or MRI technician. My conclusion is radiology is the backbone of medical field and is used by doctors to explore the many undetermined problems of their patients. I believe radiology is a fast-moving and changing field, and job security is promising over the next 20 years. I'm looking forward to the opportunity to work in the field and would like to specialize in pediatric radiology.